Good morning, everyone. We're just going to wait a couple minutes to make sure that everybody logs on, but thank you for attending this morning. Good morning. Good morning.
Hello, everyone. Good morning and welcome to our webinar session today on workers' compensation made easy with an overview of e-billing. This is Susan Martinez at EZClaim. I'm going to be one of your presenters, and along with Sally and Karen from Carisk, Intelligent Clearinghouse, formerly IHCFA. We're going to be recording the session today also and posting that on our website for anyone who'd like to watch it again or those colleagues that can't attend today. We'd also like to do a Q&A chat session at the end of the presentation. So if you could hold off your questions till then, and we'll get everything answered for you. So we're really excited to bring this overview of workers' compensation and auto e-billing to you today, with your objectives covering how easy it is to have that EZClaim premier billing software and the Carisk e-billing solution program interface together so we can securely send your claims over. We're going to be talking about the legislation changes as well that are impacting you, and share how easy it is to enable that premier billing software and set up that connection for you to get those claims over. So Sally's going to be presenting first for us, and then we're going to have Karen pick up in the middle session. And I'm going to hand it over to you now, Sally.
Thank you, Susan. Good morning, everybody, and thank you for attending this morning. We're going to go through quickly some information, some background, and get into a little more detail on the processing of the partnership between EZClaim and Carisk Intelligent Clearinghouse. But just to start, we'd like to kind of level the playing field here of understanding. I'm sure most of you know 95% of all health insurance bills are transmitted electronically, and that includes Medicare and Medicaid. Obviously, workers' comp and personal injury auto has kind of lagged behind from an industry perspective, and only about 10 to 15% of those bills are currently being transmitted electronically. Normally, providers use the same billing system to produce these bills and the supporting documentation, but up until now have really had no way to marry them together, the bills and the documents, to submit them electronically to the carriers. So this is going to be our solution today. This end-to-end solution for workers' comp and no-fault auto really does make workers' compensation and no-fault auto easy, and you'll get paid faster. EZClaim is partnered with Carisk Intelligent Clearinghouse for the Premier platform users to save you time and money and making the process of filling out the forms and attaching the documentations very easy, and being able to send them electronically, a one-click solution. Our job on the Intelligent Clearinghouse side is to validate the bills for completion prior to transmission. And this is critical to minimize the number of denials. And we'll look at some statistics that support this in a minute. We would notify you if the data that was provided through the link was missing some information or in error, again, prior to the bill being submitted to the payer or the carrier. And we would transmit the supporting documentation to the payer with the bill. So that means no waiting for the documents to arrive via the mail, no lost documents, no questions for the carriers to say, I didn't receive it, or I don't know where it is, or we can't, put the two together. So this is critical in the processing of these claims and documents. We'll also pass payer acknowledgement of the bill back to you, so you'll see when they accept it, and you'll have record of that for your use if needed in the future. And we will assist in the electronic fund transfer payment via the 835 transmission to the provider. So it is really an end-to-end solution, hitting all of the processes and the points that you might need for reference on the bill moving forward. As I mentioned, just a few statistics to back up the electronic bill processing success. You'll see here some metrics that we've compiled based on users who have been within the system for e-billing from 1 to 5 years. First-time acceptance goes up from 70 to almost 90%. We're seeing, an average of 80 to 85, so that's a big jump. Resubmission rates have gone down dramatically from 20% to 3%. This is a critical point. Revenue cycle improvements for accounts receivable has almost gone down 50% from 80 days to 45 days, and the percentage of claims over 120 days has gone down from 35% to 6%. Finally, payer status calls on e-bills is reduced by 83% as compared to print. So you'll see in all of these metrics there are benefits to the processes, the time for your practice, and your staff to get other things done so that they're not spending a lot of time with the processing piece of these workers' comp and no-fault auto bills. We're going to look at the process here from EZClaim to Carisk intelligent process. And really, it is simplified in terms of the steps between the two to get the patient bill and documents processed through to the carriers. In the first step, the provider will submit electronically their claim data for the specific patient. And you'll see on your home screen, there is an icon for send claims. So you would click on that to process the specific patient claim. In the next step, after all of the patient information is submitted and sent, we would actually then create and send a batch report to the clearinghouse of all of the patient's information that had been entered for that specific day or time period. From there, we would then, through our system, allow the provider to attach their supporting documentation to the clearinghouse, and we'll talk about some different ways that we can customize for each individual practice that process. The clearinghouse would validate the claims and edit any missing information. You would be notified if there was information that was missing or an error. And once all of the claims were clean, the claims and the attachment would be sent via a secure FSTP to the payer or the TPA when completed. Once that process was done, or through that process, we need to get to the attachment or the attaching of the documents. And through the document attachment process, you'll see here, this is our Insta-Doc process. This is a very more robust way to put together a number of patient bill records with the claims. But there are a lot of other ways which, through an individual demo, we could talk with each of you on how that could be customized. But in this method, this is called our Insta-Doc method. We would upload to the system all of the PDF records that you have for that specific group. And then through our system, we would link those records to each of the patient records that are in the Clearinghouse system. So you would find the name on the record on the left-hand side, and you would match it with the patient bill on the right-hand side. And it's a simple click to select, to marry them together. Once all of your documents are married to all the bills in the system, you just hit send and submit, and they would go off to the carrier. And again, we can talk in detail with each of you on a customized solution based on how you store and handle your medical records at this point in time. The next step would allow you to view an EDI report. So through the EZClaim system, you can click on this link at any time and view a report of all of the claims that had been processed through the first two steps that we just showed you. Finally, we would go to our system, can show you validation of the bill being processed with the supporting documentation, and everything is date and time stamped, as you can see. And at the end, you would receive an acknowledgement of when the payer accepted the bill, which is also time and date stamped. And that would allow for the payer to process and adjudicate the bill. So you have record of when it was received, and then we can talk about getting you your remittance information back after the fact. Finally, the payers do provide us with an EOB, and that EOB or electronic remittance advice would be stored in our system and can be fed back to the EZClaim system so that you can, for accounting purposes, have a full circle of the process from submission to payment of all of the steps for each specific patient record that had been entered through the system. And this allows you to, from an accounting standpoint, keep track and record of what was paid from the payer for each specific bill. Next, Karen is going to talk a little bit about legislation. There's been some recent legislation updates in a couple of states, and there are some legislation mandates in other states. We're going to talk about some updates here. Karen?
Good morning, everyone. I'm Karen Normington with Carisk Intelligent Clearinghouse, and like Sally just mentioned, I'm going to kind of kick off the back half of this webinar and talk to you a little bit about the legislations that are coming up. Primarily, we're going to talk about New York and New Jersey. If anyone that's attending at this time has any other mandates in states that are not New York or New Jersey, if you could let us know in the Q&A at the end. We're happy to get that information and research it and make sure that our portal is able to handle that in the future. So we're just going to start with New York. New York earlier this year, the Workers' Compensation Board announced that they are going to roll out 3 phases in 2019 to attack some things and bring themselves a little bit up to date. The first phase that's going to come through is going to be effective January 1st, and this is going to eliminate all the New York forms, which is going to be a great reduction in paper for your offices, as well as reduce an administrative burden. Those C4 forms and all that extra information puts a lot of pressure on the provider, which then leaves a lot of pressure on the billers getting that information out to the carriers. So this is going to be effective January 1st. So you will just be billing with the 1500 form, as well as medical documentation to support the visit. We have been working very closely with the Work Comp Board for all of these changes that are coming up in 2019, and CIC is going to be ready to move forward with each one of these phases with confidence. So, getting on board with us is going to help you meet the mandates that you need to for either New York or New Jersey. One of the other things that's going to happen is they're going to once you submit through a clearinghouse, an approved XML submitter clearinghouse, the carrier will then forward the EOB back to that clearinghouse. So that would get forwarded back to us upon adjudication, which then we will forward on to you. And again, as Sally just said, that's going to eliminate time for you on your end for, reviewing, and you're going to have that full circle being met by using our services. And the last, phase that's going to come through is that everything is going to have to go electronically. So getting on board with us is going to allow you to be up and ready, and the numbers prove that submitting electronically is going to get you in a more efficient process in your practice, as well as quicker payments. So let's move on to talk about New Jersey. Again, the governor earlier this year has signed some mandates stating that if you are a provider submitting 25 or more bills a month for no fault, auto, personal injury, or work comp, you are going to be required to submit these electronically to the carriers, and the carriers are going to be required to accept these bills electronically. So we're working hard with our providers in New Jersey, as well as the carriers in New Jersey, to get them all up and ready by the mandated dates. So for no fault, auto, personal injury, by September 1st, you need to have that in place, and for workers' compensation, by November 1st of 2019, both need to be in place. So reach out to us, and we can help you get on board for those mandates so that you're ready when those dates kick in. So typical reporting requirements. We want the cleanest claim into us so that we can get the cleanest claim out for you and get you payment as quick as possible. So as Sally mentioned earlier, CIC is going to scrub the bill. It's going to be looking to make sure that you have the most correct claim number, that you have correct coding and billing information, that you have attachments, and that you're following the requirements that are set for your state. So know that if we know what the requirements are for your state, we are going to make sure that there are some hard edits in our system that are not going to allow your bill to leave until that is completed and has what it needs on there, so that you will be able to, like I said, get your payment as quick as possible. So let's move on to implementation. Implementation is really an easy process. EZClaim has already done the tough work for you. They've already gotten the situation, the steps behind the scenes set up. So your process is as easy as 3 steps. You're going to create a Carisk Intelligent Clearinghouse account on our website. You would then contact EZClaim to let them know that you would like to work with CIC, and they're going to make some connections on their end for you, and they're going to walk you through where do you need to click, what do you need to do in order to route the work comp and no fault bills to the clearinghouse. Once that's set up and your account is set up within Carisk Intelligent Clearinghouse portal, you're going to just complete some test files to make sure that we have everything that we need. Once that's completed, you're going to be good to go. It's a quick, easy turnaround. So now that we've got you revved up and excited about using our software, what does it cost? Well, our only costs that we have are 50 cents for an electronic submission and $1 for a paper submission. So what are you getting for that $1? That $1 is getting you priority mail. It's getting you 15 pages of supporting documentation as well as your bill, and it's getting you a tracking number. So you're able to track that bill from the minute it leaves our system until it gets to its destination. We charge nothing for implementation. We have no contracts. We have no cost for training. We will provide you with tracking information. We will complete storage of the bills and information for you. Nothing ever leaves our system. And as an incentive for you for joining us in this webinar and wanting to get you guys on board, we are offering, if you sign up through this webinar, you will receive 45 days worth of electronic submission free. And that offer will expire December 31st of this year. But, you know, get on board, give us a call, and we're happy to get this incentive to you. So we're ready. So we want to just thank EZClaim for the opportunity to connect with them and share with you all the benefits of using the Carisk Intelligent Clearinghouse portal. The three of us, Sally, Susan, and I, are available to complete a demo for you that would be, like she said, as Sally mentioned earlier, customized to your practice and specialty. And Susan is available to show you where in the Premier platform, you know, what the process is on your end for EZClaim. But we would love to show you the integration and how this can improve the daily workflow in your office and bring some more efficiency and quicker payments. So feel free to reach out to us at our emails or direct lines. And I think now we're going to move to some questions and answers. So if you have some, I'm going to turn it over to Susan now, who I believe is going to walk us through that process. Thank you.
Yes. Thank you, Karen. Thank you, Sally. That was awesome. You know, we are so excited about this partnership and be able to just have that direct connection with you guys to send those claims. So I'd like to open it up to any questions. If any of our attendees want to chat in the chat box there, any questions that you'd like to send over for us right now, we're here to answer them today. You can also certainly email us or call us or get scheduled with us for a demonstration discussion. And we can do some privates with you too. Don't see any questions yet, but we'll give you guys a few minutes if you want to get your thoughts together and ask us anything while we're here. Silly, let's put that screen up with our information. And so if anybody does want to contact us, you have it. So you've got my phone number here at EZClaim and my email, Karen's and Sally's. We have a question coming through. Let's see. This is from Joey. He's asking sorry, Joey, give me 1 second. I'm just trying to adjust my screen here. The 50 cents for EDI claim also includes how many pages or any attached PDF?
The 50 cents includes, it's unlimited. There's no charge for the attachments.
Okay, great. Anybody else would like to ask Karen or Sally or myself a question today in the webinar?
I think it's important to mention that if anyone is interested in a customized demo, the demo of the system doesn't take more than 20 minutes or so, depending on specific questions. So it's not a big commitment at time, but it might answer some other questions that you didn't even know you had until you saw the step-by-step process.
That's great. Well, I don't see anybody else chatting. I do want to thank everybody for your time again. We'd love to get you on board to send your claims real easily over electronically to Carisk and get it up and running right through your Premier platform. We look forward to hearing from anyone who attended today that would like more information.
Absolutely. We're excited
Carisk
on our end too.
Yeah, I want to thank you gals so much for the presentation. It was wonderful.
No problem.
Thank you. It was our pleasure.
Thank you.
Great.
All right, everybody. Well, thank you so much for attending our webinar today. We hope you all have a great day. Thank you.
Thank you. Take care
Thank
now.
you,
Bye-bye.
Susan. Bye-bye.
Thank you again.
Bye.